Thank you so much for joining us this morning. My name is McLean Gutkin. I am the local wellness policy project coordinator at the Boeing Center for Children's Wellness, and I'm a member of the Schools Network. And today you are joining us, hopefully, for the Utilizing School-Based Mental Health and Wellness Services featuring Suzanne Snyder from the South Carolina Department of Education. So like I said, I'm from the Schools Network and I work alongside Erica Ayers at DHEC. The mission of the Schools Network is to identify and promote healthy eating and active living strategies in South Carolina public schools that empower stakeholders and encourage collaboration among those seeking to improve student health and academic achievement.
Thank you, McLean. And again, like McLean mentioned, I'm Erica Ayers. I'm the school wellness consultant with DHEC's Division of Nutrition, Physical Activity, and Obesity Prevention. And I also serve as the executive director for the South Carolina Governor's Council on Physical Fitness. And the mission of the Governor's Council is to serve the state by supporting the health and well-being of all South Carolinians through the advancement of physical activity. And due to our missions and goals aligning with the Schools Network, we have been working collaboratively with them since 2020. And an example of this collaboration is this webinar series. So if this is your first time joining us for one of these webinars, welcome. If you are a veteran, we are so happy to have you back. We've been providing these since, I believe, the spring of 2021. And the purpose in this webinar series is to enhance collaboration between schools and communities using the whole school, whole community, whole child model as a framework to support students' health and academic success. So in case you're not familiar with the whole school, whole community, whole child framework, it is a framework that calls greater collaboration between schools and communities across multiple sectors. It places the student, the child, in the center of the framework, and it takes a comprehensive approach to support their health, well-being, and again, their academic success. So in a nutshell, it provides a framework, a system to help meet the unique needs of every student so that they are healthy and ready to learn every time they walk into a school building. And today we are going to focus on the counseling and psychological and social services, or the mental services, available to students. And we are also going to open up our first poll. And while we get a better idea of who you are, and while we do that, McLean's going to give a brief description of today's webinar, as well as introduce our presenter.
Thank you so much, Erica. And so I see we have quite a few folks from state agencies on this call today, as well as not students, I misread that, school district and school administration, and then we do have some school staff and teachers. So it seems like a good mix of folks, and then we do have some from other organizations and community coalitions. So this will be very informative to you, we hope. And again, as we go through this webinar, please put any questions you have in the Q&A, and we will get to those along the way or at the end. And so today we're going to be talking about enhancing student access to mental health services and how that's a priority for the state of South Carolina. During this webinar, you will learn about the availability of various mental health and wellness services and resources that can be assessed with the help of mental health counselors in South Carolina schools. Find out more about connecting students to school counselors and communities and how that can improve the social and emotional climate at your school and home. So our speaker today is Suzanne Snyder. She is a licensed professional counselor with over 20 years in the mental health field. She works at the South Carolina Department of Education, where she is the mental health program manager, and she's responsible for helping districts such as yourselves integrate mental health in schools and respond to the mental health needs of the students and staff more effectively. And so I'm going to turn it over to Suzanne.
Good morning, everybody. You see this poll that popped up?
I am not sure if we see the poll yet. So
sorry.
If JC, if you could launch the poll. please. Or if the poll is not working, we can just do it in the chat. So
Yeah, I can see it.
Oh, okay. Oh, it is working. Apologies. I guess it's just my end.
Zoom doesn't like you today. It's okay, McLean.
Yeah.
No, it doesn't.
So the poll for, I'm going to read it for myself because I cannot see it, is can you tell if someone has a mental health problem, true or false? And so, Suzanne, I'm going to turn it over to you to let us know which is the case.
Okay, it looks like 88% of you are saying that it is false, and that is correct. A couple of people have said true. I know why that can be the case, because sometimes you might be able to tell. So what I'm going to talk to you about today, like McLean said, is mental health services in schools. So the agenda, we're going to do a quick, I know we just did that. In fact, I got really stuck on the coloring. I love coloring books. So I was like, oh, good. Now I have something on my computer that can distract me even more. We're going to do a quick exercise or like opening activity. Then we're going to talk about school mental health services, the history of school mental health services, the importance of school mental health, and some resources. And then, of course, we'll have time for questions. So this is an exercise that I took from a booklet that I paid for that has a lot of different activities. It's a self-awareness type thing. So, just looking at, how do you feel today? And this is something you can use with yourself, with your students, with your staff, with your coworkers, at home, whatever. So if you're looking at how do you feel today, and you could have them circle or write in their answer if it's something else. And of course, there's many more emotions that are, that we know, but these are just some of the ones that they picked. And then this exercise, which I think is can be really helpful, and it can be kind of fun, and the good transition is called rain tapping. So I don't know if everybody feels comfortable doing this. If you don't, it's fine. You can turn your camera off if you have it on or whatever. But you want to lift your hands above your head and curl your fingers slightly. And then you want to gently and quickly tap the top of your head using both hands, like little refreshing raindrops falling down on you. And you just tap all around your head from the back to the sides, towards your temples, ears, and forehead. You just do that for maybe like 30 seconds or however long. So rain tapping can help you become more alert. This is why I say maybe use it as a transition, or if you notice everybody's kind of squirmy. What are some other things that help you focus? There's some, and I don't think I can see the chat, but I don't know if anybody wants to put in there some other things that help you focus, either help you focus or help you get your students back to focus, or your staff.
We have some suggestions. So thank you all for sharing. Deep breathing, stretching, box breathing, mindful movements, taking a short walk, squeeze and release. I'm not sure. I've never heard of that one, but
probably like your tension, like you're probably squeezing your fists and release, and maybe tensing up all your muscles, and maybe even sometimes people will do their face.
Yes, we have a few people that really resonate with walking and then meditation.
Okay, great. I appreciate y'all sharing. And it just, just kind of gets your mind moving, and with the things we're going to talk about today. We're going to go over the history of school mental health services. So South Carolina has had school mental health services. And if y'all look at, I'm reading my notes over here so I don't mess up. So if you're like, why is she not looking at the screen? So we've had school mental health services since the 1980s. So Greenville County Schools was the first district to have school counselors. And since then, it has expanded across the state. South Carolina Department of Mental Health has been the primary provider for school mental health services. That still is the case. While the state has also branched out into hiring their some districts have hired their own mental health clinicians. They're using Department of Mental Health. They are hiring some contracting with different private agencies or organizations. So what we want to do is we want to make sure that every child that needs to be served, that needs those mental health services, gets those mental health services. And right now, there are clearly more children in need of counseling than there are being seen due to that limited availability of counselors, and the need just keeps growing. So we're going to talk about we're going to talk about that throughout the presentation, about what are we doing about it, what you can do, things like that. So I think it's poll number 2 now. So youth are almost as likely to receive mental health services in an education setting as they are to receive treatment from a specialty mental health provider. See what everybody thinks. Okay, so it's about, so 42% think that's true, 58 think that's false. It is true. So this is in 2019, you know how statistics are usually lagging. 15% of adolescents aged 12 to 17 reported receiving mental health services at school, compared to 17% who saw a specialty provider. What has been found is you're more likely to receive school mental health service, to receive mental health services in schools, because the child's already there. It's more economical, it's easier. It's kind of like school being the one-stop shop. So in February of 2022, Governor McMaster did an executive order for Department of Health and Human Services to review school mental health services. What DHHS found was that, we already said this, and we know it was discovered there are not enough mental health services in schools. There are not enough services, there are not enough therapists. And so Department of Health and Human Services was charged to come up with a plan to change this. So the plan is, and it's continuous. This happened in February of 2022. It really kicked off the school year of 2022. So we're continuing. So enhance school mental health services. Now, my position as the mental health program manager, I started in August of 2021. It's a brand new position that the Department of Education created, and I'm enhancing school mental health services, increasing mental health professionals, right along with what Department of Health and Human Services did. What they've done is make it so schools can hire their own professionals. They've opened up the RBHS, if you're familiar with the Rehabilitation Behavioral Health Services. There were only 11 districts before this that were able to bill for those services. That's Medicaid. So all of the school districts, I don't know if I can say 100%, but I think all of the school districts are now able to bill RBHS services for Medicaid if they choose to. USC created a school behavioral health academy to train qualified school mental health professionals. And one of the things that just happened just recently, was the Department of Administration approved raises for Department of Mental Health clinicians. So they raised their raises up to where it needed to be. Because if you're going to go get your undergraduate, get your master's, get licensed, and that's going to be your career, you really need to be paid accordingly. So here's the statistics from, this might be helpful for y'all if you're familiar with Mental Health America. They have a back to school youth and technology. It's a toolkit. So you can go on mhanational.org and find this toolkit. So I like to talk about statistics just to show where we are. Why are we talking about this? So 60% of youth with major depression do not receive mental health treatment. Why are we doing mental health treatment in the schools? Well, if we've got 60% of youth that don't receive treatment, what better way to look into providing that in the schools? 16% of youth report suffering from at least one major episode in the past year. That means that they were having some kind of difficulty lasting longer than 2 weeks. More than 2.7 million youth are experiencing severe major depression. And then 1 in 10 youth with private insurance do not have coverage for mental or emotional difficulties, which is over 1.2 million youth. So we know Medicaid is, the in the schools, kids that have Medicaid. But what about somebody with private insurance? And how does the school deal with that? And right now, there are some extra funds for that to happen. So DHHS is in the process of, I think maybe Department of Mental Health, figuring out how can they serve those children with private insurance. Sorry about that. Okay, statistics. So anxiety disorders are among the most common mental illnesses found in teens, with statistics showing that 4% of 10 to 14-year-olds and 5% of 15 to 19-year-olds experience an anxiety disorder. So this came from Teen Mental Health Statistics in 2023. Teen girls were more likely to report feelings of anxiety than boys. I don't know if that's a shock to anybody. 25% of teens have been diagnosed with a mental health condition. 28% of teens report having received mental health treatment. Teen boys were more likely to say they don't need treatment for their mental health. So, their teen girls are talking about it. Teen boys are like, I got it. I'm pretty cool. 67% of teens think schools should offer days off for mental health, which I thought was interesting. And 56% say their school thinks that mental health matters. So to me, that was impressive that, over 50% say that, the school is really making mental health matter. And that is something I have a private practice, and when I talk with parents who are probably a lot younger than me now, but we talk about, we didn't learn this when we were growing up. So I think it is so cool that we're working on emotions and feelings and how to deal with all of this and teaching them, because academic performance affects mental health, and mental health affects academic performance. So we need to know, with all the stress that's going on in the world today, we need to know how to deal with that. Depression is the second most common teen mental health disorder, with an estimated 13% affected by this issue. Additionally, the CDC estimates nearly 7 million children aged 3 to 18 are diagnosed with depression. So some more teen mental health statistics. I think that these statistics can really hit home. So anxiety disorders affect 31.9% of adolescents between 13 and 18. Oh, y'all, that's my Siri. He's looking up something on my Apple Watch. 37% of 30% of high school students report feeling adverse mental health symptoms during the COVID-19 pandemic. My opinion, my professional opinion, I think that's low. So I'm not sure exactly who they polled, but they're saying 37%. 44% of high school students reported feeling signs of depression within the last year. Research shows that untreated teenagers with anxiety disorders are at a higher risk to perform poorly in school, miss out on important social experiences, and engage in substance abuse. So we really want to focus on how do we get services to our students. So what is mental health? So this is from samhsa.gov. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act, and helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adult, so cradle to grave. Over the course of your life, if you experience mental health problems, your thinking, mood, and behavior could be affected. Also, mental health, mentally healthy children have a positive quality of life and can function well at home and school and in their communities. So if they're not mentally healthy, that's where you see some of the issues. So early identification. So we're going to do poll number 3. So school-based mental health services are delivered by trained mental health professionals who are employed by schools. So that would be, are there school psychologists and school counselors, school social workers and school nurses, or all of the above? So if everybody's had a chance to answer. Okay. Yeah, so it is all of the above. So if you chose school psychologists and school counselors, you're right. School social workers and school nurses are all of the above. All of these professions are delivering some type of mental health support. So by removing barriers such as transportation, scheduling conflicts, and stigma, school-based mental health services can help students access needed services during the school day. So why do we want to do school mental health in schools? Right there, it removes those barriers. Knowing and addressing early signs of mental health conditions increase the chances of recovery and positive outcomes. So that prevention, so to speak. Children and youth with more serious mental health needs may require school-linked mental health services to connect youth and families to more intensive resources in the community. There are some districts that have that family counseling, the family mental health services. Because so much time is spent in the classroom, teachers and other school personnel may be the first to notice symptoms of depression and anxiety in students. And it is important to let children and teens know that support is available. It has been shown that support, consistent support, it may be at home and school, it may be at church, it may be an after-school program, it may be a coach. But working together to educate about mental health and online behavior, as well as acting as good models of what to do, can positively impact that young person or child. Parents, teachers, coaches, and other adults in a young person's life can provide different perspectives on the child's behavior. By sharing information, a clearer picture of the student's well-being can be established. However, if a young person isn't getting that support in one area of their life, having one or a few adults to lean on makes a huge difference. So if they don't have that support at home, if they have just one person outside of home, that can make a huge difference. And this is from the that Mental Health America Back to School toolkit. So poll number 4. If I ask someone if they're thinking about suicide, that will make them consider suicide. True or false? Okay, we'll see if everybody's had a chance to answer. Yes, most definitely it is false. So what is the Jason Flatt Act? On May 14th, 2012, Governor Nikki Haley signed the Jason Flatt Act into law. And as a result, South Carolina became the 10th state to pass this important legislation. This legislation requires mandatory youth suicide awareness and prevention training for teachers and principals. You may notice that maybe you've taken the Signs Matter registration that Department of Mental Health provides, that the registration runs through Department of Education. I pass that on to Department of Mental Health. So the major components of the legislation are you have mandatory youth suicide awareness and prevention training for all middle and high school teachers. I wish it was elementary because unfortunately we do see the younger kids that attempt or thinking about suicide. This began with the school year of 2013-2014. So in-service must include 2 hours of youth suicide awareness and prevention education. This training is required to maintain or renew your teaching license. And the training counts towards the 120 hours of credit already needed to renew every 5 years. So you can get those 2 hours every year. The South Carolina Department of Education developed guidelines for suitable training materials, and the suitable training materials may be accomplished through self-review of suicide prevention material approved by your school district. So suicide is the second leading cause of death among youth aged 15 to 24. Approximately 1 out of every 15 high school students reports attempting suicide each year. 1 out of every 53 high school students reports having made a suicide attempt that was serious enough to be treated by a doctor or a nurse. So 1 out of 53 high school students. So, put that in the number. So you probably got maybe about 1 in every, almost in every classroom, every other classroom, probably. So several factors increase the risk of suicidal thoughts or behaviors. So some things to look out for. That does not mean that they are going to actually have suicidal thoughts or behaviors or an attempt. But these are just some factors that increase the risk. So mental health disorders such as depression, anxiety, and other mood disorders, alcohol and substance abuse, impulsive behaviors, a history of trauma or abuse, family history of suicide, or previous suicide attempts. So if you combine all those, if somebody has depression, they're using substances, maybe they have, don't have a really good home life, maybe a family member, someone close to them has died by suicide. Maybe they've already had suicide attempts. Each one of those things just increases that risk. And of course, not everyone exhibits the same signs that they're thinking about suicide, but these warning signs are cause for concern. So other things to look for: physical changes in appearance or hygiene. So, are they losing weight? Are they wearing the same clothes? Are they disheveled? Are they not bathing? What's going on? Did they change drastically? Like, it's just something out of the ordinary. An increase in alcohol and drug use, would you know that? Maybe the parents would. Could be a sudden drop in grades. I know everybody in the education world, if a child's grades drop suddenly, that is a definite warning sign. Social withdrawal. Maybe they quit a sports team or a club, they stop hanging out with friends. You're just noticing something. If they're talking about suicide or preoccupation with death. Risky or reckless behaviors such as reckless driving, maybe just doing some things out of the ordinary. Self-harm behaviors such as cutting. You may not see it, you may hear about it. Some peers may talk about it. They may talk about feelings of hopelessness or have nothing to live for. So like, what's the point? Why am I here? I'd just be better off if I wasn't here. Research suicide methods or acquiring weapons. Like, are you noticing, like if they do a research paper, they do a talk, they're doing a project on suicide, what's the reasoning behind that? Is it because they are genuinely, that is something that they're passionate about and they want to help suicide prevention, or is that something they are researching to do? If you have any concern about a young person's mental health, take action. Ask for help. Talk to somebody in your school. Talk to the parents. So how do you offer that support? So express your concern. It is a myth that if you mention suicide, you might plant the idea. By honestly and openly expressing your concerns, you'll send an important message that you care and understand. Maybe you're that one person that expresses concern and says, hey, you matter. I'm here for you. Really listen. So parents, and I think probably all of us, can be tempted to shut down an upsetting conversation by saying, I don't want to hear those things. Don't talk like that. Or, you know what? I had a hard time as a teen, but I got over it. So you will too. Something you could say instead is, tell me more about how you're feeling, then listen. So maintaining that connection, you might want to safeguard a teen by keeping them home in a protective cocoon. You might see that, the parent or the person's trying to isolate them so that they can keep them safe. But helping a struggling child maintain connections with friends and loved ones, that just solidifies that support. They need that interaction. Spending time with that child, doing things with them. These are things you could offer to the parents, or somebody comes to you about this. Be compassionate. Express your love, your care for that child. Tell them you hear their pain, that it can get better, that you will make sure that they get help, and you'll support them every step of the way. We're in this together. I'm not going to give up on you. Trust your judgment. If a young person denies they're having suicidal thoughts, but you doubt that, trust your gut, trust your intuition. Take further steps to ensure their safety. Who in your school, who in your community can you talk to make sure that student gets the help they need? And prioritize safety. If somebody asks, hey, my child's been saying this, or if you have a child or a loved one, what's their plan? It might be having to remove those weapons from the house, making sure that they're not left alone, but they're not isolated. And of course, consulting a mental health professional. And of course, September is Suicide Prevention Awareness Month. So I'm sure you all know about MTSS in South Carolina schools. We're going to go over it anyway because I think it's important. And this is also talking about the whole school, whole community, whole child. So in 2018, Governor Henry McMaster signed into law Act 213, which directed districts to implement MTSS, multi-tiered systems of support, beginning in the 2019-2020 school year. So MTSS, or multi-tiered systems of support, addresses the needs of the whole child academically, behaviorally, socially, and emotionally through a holistic and personalized system of learning that incorporates academics and social emotional behavior into one framework. So we're not just talking about academics and then behavior or mental health. It is incorporated all in one. So what is MTSS? Multi-tiered systems of support. It's a framework that helps educators provide academic and behavioral strategies for students with various needs. We now know as teachers, you have so much stuff going on. You have so many things to do. So this shouldn't feel as an extra burden. If you improve someone's behavior, their emotional, their mental, their social learning, that is in turn going to help their academics. And of course, it has grown to encompass all students. It grew out of the integration of two other intervention-based frameworks for response to intervention, RTI, and PBIS, which is the behavioral things that we were using. Early assessment and intervention with these students help them catch up with their peers sooner. So early assessment and intervention, prevention. How do we improve these outcomes with students? So some key components. Y'all are probably doing universal screening of all students in the school year. I think that it's typically like first grade and fifth grade, but I know some schools are incorporating that more often. There's tiers of intervention that can be amplified in responsive levels of need. There's data collection, continual assessment, because you just don't start doing something. You need to have data. You need to have reason. You need to make sure that that the needs are being met and that children are learning, and that children are actually progressing. And also, you can't do it without parent involvement. You have to have that parent and community involvement. So this is just this is a graphic that I like that just is, kind of looks at MTSS, all children, whole child, that whole umbrella. So you have the parent engagement, and it organizes. So MTSS organizes systems of processes and procedures that allow local education agencies, or LEAs, to create prevention, enrichment, and intervention opportunities. So you're looking at curriculum design. It supports teachers. It gives a positive school and district culture, professional development. You've got that school and community collaboration. So just, all the things. And in a strong, sustainable, multi-tiered systems of support framework, the mental well-being, academic and behavioral needs of the student are taken into consideration at each level, because you have the tiers. Tier 1 is universal, Tier 2 is targeted, and Tier 3 is intensive. And it takes strong collaboration and collective responsibility. So communication, collaboration, responsibility throughout all. So staff, so administration, staff, parents, community, children, everybody. And this is just, so you're looking at the way that MTS provides a method for early identification. So those 3 tiers. So if you look at tier 1, it's going to serve, that's universal primary, the majority of the students, 75 to 90%. And that could be the something that every child gets, which could be learning about emotions. It can be what they're getting in the classroom as far as their instruction, because remember, it's not only is academics along with the social, emotional, behavioral, mental health part. But I'm talking more about the mental health part. So that would be everybody's getting those. Then the tier 2, the small group. So that would be more of a, if it's a social worker or even the mental health professional that is doing things like small group check-in, check-out, interventions, working in those small groups to work on the goals that they need to. And then the tier 3 individual students, or that family therapy, it gives students individualized support. So that would be the mental health counseling, that individual therapy that a student might need. So these are just, I thought it would be, I'm a visual person, so the types of school-based mental health services in the tiers. So of course, the tier number 1, you're looking at school-wide screening, mental health literacy programs, social emotional learning curriculum. So you've got PBIS, Project Achieve, then targeted tier 2, which is the targeted, those small groups, coping skills, strengthening families programs, positive action, targeted screening for specific conditions. So you might do like depression screening. And then that tier 3, that's the individual assessment, the individual counseling. And so with a school counselor, and maybe if you don't have it in the school, or it is, I guess, more serious, more chronic, more in-depth, more intensive, it might need to go to a local provider outside of the school. And then other services indicated for the student's condition. So what does school climate MTSS? So MTSS creates a positive environment for all students, which in turn impacts school climate. So positive school climate, what does that do? That's the leading indicator for such outcomes as increased academic achievement, increased teacher retention, and we all know that there's a teacher shortage. So anything we can do to keep teachers, to get teachers, and also reduce those discipline referrals. If that is something that is that we hear about, that the discipline referrals. How do we increase academic achievement, keep teachers, and reduce discipline? The interventions and supports found in MTSS help in relationship building, and that's key. Relationships is a key factor in student success. They need those relationships. And a supportive school environment allows each student to work through their challenges and catch up with their peers. If they're in a school that's supportive, they care about them, they know that everybody in their circle is genuine and wants to help them, they're going to be more apt to put forth the effort. If they don't feel that support, if they don't have that genuineness, they're probably not going to. We're all like that. This is not just students. We're like that with adults. If you're in a environment, in a work environment that's not very positive, you're probably not going to thrive and produce as much as you would be if you've got like a great boss, manager, director that is there to encourage you. And also just make sure that as y'all are thinking about it, MTSS tiers may look quite different from school to school, because not each district is different. So just because one district's doing it this way, it might be different in another district. So I think it's great to share. South Carolina was chosen for the second cohort for the whole school, whole community, whole child. But what we do is we work with other states around the country and the districts within our state, so 5 districts, but they're all different. They're different sizes. Some are rural, some are in the city. It's up to each school to develop that MTS framework that is specific to that school community. So factors that make teens more vulnerable to developing mental illness. So what are you looking at? So we're looking at a family history of mental illness. So if you know that, like if the mental health clinician has done an assessment, maybe a family history, and they know that the mom has a history of bipolar disorder or a mood disorder, that doesn't mean that the child is going to have that. That just makes them more vulnerable. Dysfunction in the home, we know how that affects children. If they don't have that kind of calm, supportive home life, that can cause issues. Abuse of substances, that is whether they're abusing substances or they are affected by someone. Bullying, we know this is across the board in school, outside of school, wherever it is. I mean, bullying can really affect a child. Physical, mental, and sexual abuse. Of course, that's that's really going to affect a child. So access to school mental health services reduces negative outcomes. So what we're looking at is disciplinary referrals, dropout, substance abuse, involvement in the criminal justice center. Access to school mental health services is going to reduce these negative outcomes. It is going to reduce disciplinary referrals, dropout, keep them from using substances, hopefully, and then keeps them out of the criminal justice system, DJJ, or eventually jail, prison. So the benefits of school mental health. Studies have shown the value of developing comprehensive school mental health programs and helping students achieve academically and have access to experience that builds social skills, leadership, self-awareness, and caring connections to their school community. Mentally healthy students are more likely to go to school ready to learn, actively engage in school activities, and have supportive and caring connections with adult and young people, and use appropriate problem-solving skills, have non-aggressive behaviors, and add to that positive school culture. So to me, that makes sense. It sounds easy, but it's not. That's why we need to have, because although many students are mentally healthy, the Center for Mental Health in Schools estimates that between 12 and 22% of school-age children and youth have a diagnosable mental health disorder. And there again, because they're in school the majority of their time, schools play an increasingly critical role in supporting these students and providing a safe, non-stigmatizing, we want to destigmatize mental health, and supportive environment. Also, families have access to prevention, early intervention and treatment through school-based mental health programs. I see some districts that are doing some amazing things around families, helping them develop good coping skills, helping the family know how to parent and work with their child. So that early identification reflects the school climate, and it helps us be able to comfortably talk about addressing mental health, which may reduce that stigma. And then the push, and it has been, and I know schools are doing great things, but we want to continue to do this. So I think there was a breakdown with COVID to collaborate with community partners. So they have found that they can enhance the academic success of individual students if they partner with other community agencies. So these partners have found to significantly improve school-wide truancy and discipline rates, which increases the rates of high school graduation, and it helps create a positive school environment. So the benefits of a school mental health, more benefits. Comprehensive school mental health promotes well-being and social emotional health for all students and staff, and while also supporting those mental health challenges as our nation continues to advance equity and access to resources and opportunity. School mental health services can be a key factor in reducing disparities in academic achievement, physical and mental health, and access to quality care. I think my personal opinion, I think mental health can be incorporated into all areas of instruction in schools. It can reduce health disparities, especially for low income and youth. So access to school mental health services improves physical and psychological safety. I mean, how does it do that? So they're feeling better, they feel safe, it increases their mentally more healthy. And then mental health affects academic performance, as does academic performance affect mental health. And then there's social emotional competence. Hopefully, if it's kind of you can look at it as like being contagious. Like if a child is learning that mental health literacy and it's working for them, hopefully it'll spill out into other areas of their life. So here's another little exercise. So again, you're doing like right now, how do you feel today? Are you like, oh my God, when she ever going to stop? Or tired, maybe you're sad, maybe you're anxious because you've got stuff going on, or maybe you're just like, okay, well, this is good information, great. And then my support team. So this just gets you thinking. It can get your student thinking. Who are some of the people you can turn to when you really need support? So if you're, and this is great for adults too, because we need support. We really need to remember that. Don't forget that. When I feel worried or stressed out, I can talk to, and I would say probably my best friend, my husband. When I'm struggling with school, I can ask, and that would be work. So I could ask my coworkers or my director or my mentor. When I need a good laugh, I can talk to, that would definitely be some of my coworkers are my best friends. But definitely just a good laugh is always good. When I need help with the problem at home, I can talk with, I would say, my husband or maybe my dad. So y'all are thinking about my support team, because some people will say, adults, children, everybody, I don't have anybody to support me. And when you do those open-ended questions, not like who supports you, you say, okay, well, when you feel worried or stressed out, who can you talk to? And that can open up that conversation. Oh, well, I go to my grandmother, or I've got my neighbor, or my mom is great, or my Sunday school teacher. There's all kinds, my after school person. There's all kinds of different people you can talk to. So this is it's actually back in front, but I only listed this part. This is a flyer that Anna Duvall, who is the director for school counselors and career specialists, just looking at, okay, who are the health providers in South Carolina in the schools? What do they do? So this is just, just a really simple, I think, a great graphic. So you're looking at school counselors, what do they do? School psychologists, what do they do? School social workers, what do they do? And school mental health clinicians. So if you're looking at that, if you can see it, maybe better than me, They do overlap some, but there are some differences. But you know that these are, I think the school nurse needs to be in there because they definitely provide some of this too. But this is something that we hand out, like we're like, okay, this is, these are some of the people you can go to in your school. So myth or fact? So mental health problems don't affect me. Myth or fact? So I'm going to say myth. Mental health problems are actually very common. Children don't experience mental health problems. We had that. Every young child may show early warning signs of mental health concerns, even very young children. These mental health problems are often, they could be diagnosable, and that early prevention could help them later on in adulthood. People with mental health problems are violent and unpredictable. That's definitely a myth. The vast majority of people with mental health problems are no more likely to be violent than anyone else. Personality weaknesses or character flaws cause mental health problems, and people with mental health problems can snap out of it if they try hard enough. Well, those are both myths, because it's not a personality weakness. It doesn't have anything to do with being lazy or weak or the fact that they just don't want to get better. Because we've got those biological factors, life experiences, and they're just not going to be able. If you have ever suffered from depression or anxiety and had someone say to you, "Oh, just get up and do it, you'll be fine," that that's okay if you've got the blues or if you're not feeling well. But if you have depression, if you have major depression, generalized anxiety, that's just going to be very difficult for you to do. Therapy and self-help are a waste of time. Why bother when you just take a pill? You can take a pill, but that talk therapy, those self-help skills, those are things that can help you move forward, that can really help you get that support and that healing during that recovery process. Prevention doesn't work. It's impossible to prevent mental illness. Well, sometimes it doesn't work. The majority of time, prevention can focus on addressing known risk factors, such as exposure to that trauma. If you know that a child has experienced maybe a tragic situation, you can promote the social emotional well-being of children and to prevent that. So poll number 5. Okay, engaging in self-care routine has been clinically proven to reduce or eliminate anxiety and depression, reduce stress, increase happiness, and more, or all of the above. And we'll see what your answers are. Okay, yeah. I mean, it does reduce or eliminate anxiety and depression, reduces stress, increase happiness, and more. So all of the above. So research shows that taking time on a regular basis to plan and attend to self-care can greatly decrease stress and increase self-efficacy. So you as teachers, you as educators have many time restraints and busy schedules. Often taking just a few minutes for sharing and offering mutual support can make all the difference. When educators come together and connect, it builds a sense of group cohesiveness. In fact, our research shows that a sense of belonging serves as a protective factor in decreasing overall stress. So that belongingness, that support, being in a group, having that camaraderie. Well rested, happier, content, able to be supportive of others. So, those importance of self-care, why are we doing it? So mental health, take just a short minute to think about what you do for your self-care and your mental health. Are you doing anything for it? Do you take time on a regular basis to plan and attend to your self-care? What kind of things do you do? If you're not doing something, then I challenge you to do something. It does not have to cost money. It does not have to take up a lot of your time. It can be, y'all mentioned it at the very beginning. It can be a deep breath. It can be tensing. It can be getting up and taking a walk. It can be getting a cup of coffee or water. It can also be getting a massage or going on vacation. But the benefits is that, it just really, it can really reduce your stress level. So this one teacher, Nadine Galden, she's also a certified positive discipline trainer. She said she realized when self-care was important. She started to watch herself and realized that when she was tired, she would yell more in her class and get more punishments. Have y'all noticed that? I mean, I know for me, especially at home, or I mean, in my work life too, if I'm not well rested, if I'm hungry or hangry, I'm going to be shorter. I am going to snap. I'm not going to be able to hold it together. So that's what happens with our kids too. And it's so easily to get off track. So investing more in self-care, because we do so much and it's so important. Because if you're going to take care of yourself, if you're going to take care of other people and you're a caregiver as an educator, you have to put yourself first. So, it's, how do you teach? Think about it. How do you do your job when you're well rested and fed? How do you do your job when you're tired and hungry? If you look at yourself and notice what's going on with you, it might be easier to see your students. And you can always, those are some of the benefits of, it's going to make you a better teacher, a better person, has all kinds of benefits. You can always identify and correct. Nobody's perfect. Even sharing with your students, hey, I woke up late this morning. I'm struggling. That just shows, that shows your students that, hey, you are a real person, because I'm sure that has happened to me. This is a poster or graphic that I like from the National Institute of Mental Health. And it just talks about my mental health. Do I need help? Sometimes we don't know. I'm a licensed professional counselor. That is what I do for a living. I don't always recognize what is going on with me. So running down that these questions, and it can help you with yourself. It can help you with your loved one. It can help, it's just something to have as a resource. So resources in South Carolina, you have your school mental health professionals. That's someone that works in your school district, in your school, that is trained in mental health services. Your local community mental health center. So there are 16 of those in the state. Also, the South Carolina Department of Education, I'm the mental health program manager. I don't know everything, but I can help get you there or find out for you. Please use me as a resource. That School Behavioral Health Academy, or the SB, you know what? It's not SB, it's SC. Y'all, that's a mistake. SBHA, so South Carolina School Behavioral Health Academy.org. Sorry about that. And then also, if you're not sure, you probably are though, SCHEMA, which is the South Carolina Infant Mental Health Association. Yes, there is an infant mental health association in South Carolina that specifically works from birth to 3 or 5, something like that. They have some really good resources. And then Children's Trust of South Carolina, they work along with the Department of Education and school districts in doing strengthening families, parenting, services like that. Some other resources, we've got the 988. It's moved from the suicide hotline. It's 988, like the 211 number we have. 988, crisis call or text. You can text 988. South Carolina Department of Mental Health has the Office of Suicide Prevention. Also, I saw Lee Fletcher on here. He is the school mental health director for Department of Mental Health. We've got the American Foundation of Suicide Prevention. We also have the SC Hopes free depression screening. I'm also going to show you another new thing from Department of Mental Health. Classroom-wise, what is that? So that is offered through the Mental Health Technology and Training Services. So MHTTC, Mental Health Technology Transfer Center. I always get that confused. So classroom-wise, you can Google classroom-wise. It's a free 3-part training package that assists K through 12 educators and school staff in supporting the mental health of students in the classroom. This is if you want to get more information. It gives you evidence-based strategies and skills to engage and support students experiencing adversity and distress. It's free. They have resources, a video library. It is just something if you want to, get some more information. So this just, I think, launched last week. Lee Fletcher sent me the flyer, and I wanted to make sure I shared it today. So Hope Connects SC Kids. So there is a Hope SC, but that adults can go and do a screener. This is for adults to screen for their children. You take a questionnaire on behalf of your child, you get feedback. You can also get support from a program counselor, like live, like right then. And they can give you resources and things like that. I think that's a great resource. So here's the School Behavioral Health Academy courses. As you notice, the All Hands on Deck, that's a 90-minute. These are free. You can also get SCDE renewal credits. The All Hands on Deck is a great overview. It's self-paced. The other courses are a little bit longer, but you can get some certificates and, of course, the SCDE renewal credits. Something that I created, if y'all are interested in that, if you don't have it or you'd like to get a copy, you can contact me. People wanted something to hold. So this Mental Health and Wellness Guide is a 52-page, just handheld little booklet that goes over these topics at the on the back. So stress management, depression symptoms, has local resources, suicide, things like that. And then here's my contact information. I'm the mental health program manager at South Carolina Department of Education. There's my email. There's my phone number. Leave that up for a minute, and then I don't know if I left time for questions or not.
Thank you so much, Suzanne. You did leave about 3 minutes, and we do have 2 questions in the chat.
Okay.
Thank you so much for this informative webinar. I really found it beneficial just as a public health professional, and I hope that everyone on the call did as well. So Andrew Williams asked, if the increase in mental health in schools is being mandated by the state, what are they doing to train new mental health professionals? And what are they doing to ensure that their quality of life while they work What are they doing to ensure their quality of life while they work with impacted populations?
That's a great question. So, the University of South Carolina, along with Department of Mental Health and the John H. McGill, and I believe it's also Blue Cross Blue Shield, have several internships. So they have one for undergraduates, and that is for all. It's not just USC; it's for all. It's for the whole entire state. So for undergraduate, can apply for an internship to work in a school to get that experience to see if they want to go into the mental health field, like the master's program for graduate school. Then they have a scholarship program for master's level where they work in the school and get supervision through Department of Mental Health. And they work all over the state in different schools. And so they get that experience there because, you come out of graduate school and it's not like you're like, oh, I know how to work in school. So we've got to figure out, how do we make sure that somebody wants to work in a school, that it's, that is the area for them. And how do they take care of themselves in the graduate program? And I think they do a much better job now than they did when I was in graduate school years ago. They focus on self-care. They really make that a priority. I know they do in social work. They do that in the counseling program, psychology. They make a priority. Take care of yourself. If you've ever flown in an airplane, if that oxygen level drops, you put the air mask on yourself and then you help your neighbor. And so that is a priority.
Thank you so much, Suzanne. And we had one more question from Erica. Engaging, educating, and helping parents is so important, and we could all benefit from learning effective emotional coping skills. As a parent, I understand the embarrassment and pride that comes with asking for help or admitting that you're falling short. How do you help schools overcome this barrier to reach parents?
Like I said earlier, there are some districts that are doing some incredible services and podcasts and information and resources for parents to encourage them and break that stigma. And so I try to, when I get questions from different districts, I connect them with the districts that already have we don't need to recreate the wheel. So connect them with those districts, and just being supportive, just being genuine and, sharing some of yourself. Because I know I say, I have kids and I'm like, I'm not the best parent. I've made mistakes and it's okay. You can identify and correct it. And to get that support is not a weakness. That is a sign of strength because you want to improve.
Absolutely. Thank you so much. And I think we are out of time, but you are right. It takes a lot of strength and courage to be vulnerable. And I appreciate you sharing the plethora of resources that you have at South Carolina Department of Education. And I hope everyone on this call has found this beneficial. And please reach out to Suzanne if you need anything. Our next webinar is going to be October 18th. How to build first aid skills for students and vaccine confidence among parents. And you can register at pulsefire.org. Erica, is there anything else you would like to say?
Just want to thank you, Suzanne. I always appreciate doing these because we always learn so much, and we're so thankful to have this space. Thank you, Pulsefire, to share these resources statewide. So thanks again. And we will be sharing recordings with everyone who has registered. And then also evaluations will be going out. And if you complete an evaluation, you get a certificate of attendance. So I hope to see you all for our next webinar next month. Thanks, everybody.